Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Constipation is the most common digestive complaint in the U.S. population. Every year, chronic constipation leads to around 2.5 million doctor visits and medication costs that are in the many hundreds of millions of dollars. Now, occasional constipation is common, but some people experience chronic constipation. It doesn't get any better. And it's a problem that can interfere with activities of daily living. It can actually make your life miserable. You feel bloated, headachy, irritable. Bad problem.
Yeah, chronic constipation may also cause excessive straining to have a bowel movement, which can lead to hemorrhoids, anal fissures, and other problems. Treatment for chronic constipation depends in part on the underlying cause, and there are steps you can take to help prevent constipation. Here to discuss constipation is Mayo Clinic gastroenterologist Dr. Jean Fox. Welcome back to the program, Dr. Fox.
Thank you. Good to be here, Tracy. Good morning.
Thanks, Dr. Fox, for being here. I know you're busy because this is such a common problem. And I think the first question is, what is constipation? How do you, an expert, define it?
Well, constipation means different things to different people. As you two have already touched upon, Tom, constipation can mean straining to have a stool. It can mean infrequent stools, it can mean hard stools, it can mean a sense of incomplete evacuation. So a lot of times when I'm visiting with a patient, I try to get right to what they're experiencing rather than using the broad term. I try to get really very specific about their symptoms. And in fact, in our motility clinic here, we actually use a bowel symptom questionnaire that helps us to get to those very specific points to see exactly what somebody's having trouble with.
I suppose different things for different patients.
Exactly.
What is the cause of constipation? I suppose if there's so many different symptoms and there's lots of different causes, or no?
Well, there are lots of different causes, Tracy. That's a great question. So one of the most common causes can be diet. Either, eating a very low residue diet or a very processed diet.
What do you mean by low residue?
Some more processed foods, kind of fast foods, that white squishy bread that we all loved as children. It's not so good for your digestive system.
Wonder Bread.
Yeah, that's not so good for our digestive system. The other thing is skipping meals. Skipping meals can be a big problem. So people who are skipping meals don't experience what we call a gastrocolic reflex, which is a reflex where when your stomach is distended by food, your colon contracts, and that makes your colon want to empty. So people who are frequently skipping meals can have issues with constipation as well.
All right, diet's a big one. Probably the biggest risk factor or the biggest contributor to constipation.
I think it's right up there. Another real big one is not drinking enough fluids or not drinking the right fluids. And sometimes, particularly with my older male patients who may not want to be disturbed and have to get up at night, they may be really limiting their fluid intake, and then that can cause difficulty with their digestive system and lead to constipation.
Best laid plans on that one.
Yes. And another one is medications. So whenever I visit with somebody in the clinic who's experiencing difficulty with constipation, we go through their medication list. And some of the medications that can be really quite constipating are anything in the opioid pain medication family, and then certain medications that we use for blood pressure control, particularly calcium channel blockers, can sometimes cause difficulty with constipation.
What's an example of a calcium channel blocker so our listeners might know if they're how would they?
Procardia.
Okay,
yeah.
And that's a lot used frequently.
Nifedipine, for some people, those things can be constipating. The other big class of medications that can be constipating are some of the medications that are used to treat psychiatric disorders like anxiety or depression or schizophrenia. And so we always look at the medication list, and it's not to say that we should be stopping those medications. Sometimes those medications cannot be stopped and should not be stopped, but we can partner with the primary care doctor or the psychiatrist or the cardiologist and the patient to come up with a plan that's going to work for them.
All right, so we probably ought to talk about treatment and what you can do for the patient who is. Oh, one more question I wanted to ask you. Why is it that constipation seems to be more common as we age?
Yes. So there are several reasons. One is as we age, most people, tend to be on medication as they get older that they may not be on when they're younger. The other thing that I meant to touch upon, and thanks for reminding me, is more sedentary lifestyle. So if you're not as physically active, that also has adverse effects on your digestion. So, if we're less active as we age, people particularly spending a lot of time sitting, that can lead to more difficulties with constipation.
So how do we help these people?
Yes. So I generally approach things in multiple areas. We always talk about the importance of diet, getting dietary fiber, and we'd really like people to get in the range of 28 to 30 grams a day. Most people in the United States probably get in the range of 12 to 15 grams a day, so not as much fiber as
By
we
half.
need to. Yeah, so that's a struggle, but with a conscious effort that can happen. The other thing is making sure that they are staying hydrated and choosing fluids such as water that are going to help with your digestion, instead of things that act more as a diuretic and make you urinate, such as like caffeinated beverages make you urinate more. So a little caffeine is good. It can stimulate your bowels and cause some colonic contraction and help with emptying. But a lot of caffeine will have a diuretic effect, and you will urinate more, and there will be less fluid available for your digestive system. So the first thing is to talk about diet and hydration, and then I talk about sleep-wake cycles, because our colon is at its most active in the morning when we wake up, just like we have our sleep-wake cycles as part of our circadian rhythms. Our bowels have a similar rhythm, and your colon is at its most active in the morning, and that's why most people will have a bowel movement in the morning. What can be done to accentuate that? Eating a meal. So I talk to people about their diet, and I say, do not skip breakfast. Breakfast is really, truly is the most important meal for people who are struggling with bowel problems.
Another reason why breakfast is so important.
Yes, and so we talk about that. And then I will talk about medications. And in general, we'll usually start with an over-the-counter laxative such as an osmotic laxative like a magnesium. Just plain old magnesium salts can be very helpful. Something as simple as a little bit of magnesium oxide, which you can get over the counter at a health food store or at Target or Walgreens or any of the big box stores. And then we might talk about the occasional use, if necessary, of a stimulant laxative like bisacodyl or the use of an enema, depending on what somebody's needs are. So we kind of step it up. But the first thing I really like to get at is diet, physical activity, staying hydrated.
And if you don't, certainly you're uncomfortable, but what can happen if you don't address chronic constipation?
Yes, so certainly you're uncomfortable, and a lot of people experience pain and bloating and sometimes even nausea and upper GI symptoms. People who have reflux, your reflux symptoms can get worse if your constipation is poorly controlled, and so that can lead to a lot of distress. But as you touched upon, there can be problems with the pelvic floor, like hemorrhoids, which can be painful. They can bleed. They can also get thrombosed, which is a very painful condition and requires surgery. There can also be, from straining, the development of anal fissures, which again can be a very painful
Little cracks
tear.
in the anus.
Yes, a little crack or tear in the anal canal, which can be very, very uncomfortable and can take weeks to even sometimes a couple of months to heal. We also worry about, with excessive straining, symptoms of pelvic organ prolapse in women. So those things would be like a rectocele or a cystocele.
So that's where either the bladder or the rectum actually come outside the body.
Well, they may not necessarily come outside the body. Coming outside the body is the worst case scenario. That's a full prolapse. But sometimes things can prolapse or herniate and still be inside the body, but yet cause problems with pressure or a feeling of incomplete bladder emptying, those types of things.
So none of that sounds very good.
No.
So the things to do before you may need to try laxatives or other medications are 28 to 30 grams of fiber per day, critical.
Yes.
Hydrate, exercise, and don't skip breakfast.
Absolutely.
All right, we've been talking about chronic constipation with Mayo Clinic gastroenterologist Dr. Jean Fox. Dr. Fox, thanks so much for being with us.
So nice to be with you both.